you very much. Now, good morning, everyone in the hearing room, and in particular, good morning, Mr. Gale, and welcome back to the continued hearings of the Health and Social Care portfolio of the inquiry. Today, as I understand it, we're going to hear from two witnesses in the morning and two in the afternoon. Melanie Newdick in the morning and Sharon Boswell also in the morning. Mr. Gale, are you ready to commence the evidence?
Yes, indeed, my lord. Good morning. And
good morning.
I think on behalf of everybody associated with the inquiry, we are very pleased to see your lordship back in position, albeit not in the room. Yes, the first witness is Melanie Newdick. She is a member of the Scottish COVID Bereaved group, thus represented by Amma Anwar and company. It's been agreed that I will call Ms. Newdick Melanie for the purposes of discussing with her evidence during the inquiry, so it's that slight difference from the norm. But she is our first witness. Her statement, my lord, for the reference is SCI WT 0248 and then 501.
When you're ready.
Thank you.
Mr. Gale.
Just waiting for the witness, my lord.
I see. Thank you. Good morning, Ms. Newdick.
Hi, Lord Brailsford. It's good to see you. I hope you're okay.
Yeah, I'm fine. Thank you very much indeed. Right, Mr. Gale, when you're ready.
Thank you, my lord. We've agreed, Melanie, that I'll call you Melanie for the purposes of today's evidence.
Yes.
But we also know your full name. It's Melanie Newdick.
Yes.
Your details are known to the inquiry, and you've provided the inquiry with a detailed statement, and I've given the reference to that statement. And as I understand it, you're happy that the statement and that the evidence that you are about to give today will constitute your evidence to the inquiry, and that it is published and recorded.
Yes.
Now, the person about whom you are going to talk is your late mother, Christine Elizabeth Newdick.
Yes.
And she was 77 when she died at home with you.
Yes.
And she died of COVID in January 2021.
Yes.
And you tell us that your mother suffered from vascular dementia.
Yes, she did, yes.
Yes, and that she was in a care home from February 2019 until shortly before she died, when she came back home to live with you.
Yes.
And I think that element in the history of the arrangements is I won't say it's the unique element, but it is somewhat different to many of the deaths that we have heard about, that
yes.
She came back from care home to be with you at the end.
Yes, I managed to get her out of the care home and bring her home, so, yeah.
The inquiry is aware of your present employment, but just so that we can put your evidence in some context, you tell us at paragraph 75, it's not necessary for this to be brought up, but at paragraph 74, I'm sorry, that in the period when your mother was in a care home, you were on the board of Highland Health Board. Right?
Yes, I was the vice chair of NHS Highland.
Yeah, and so from that perspective, you are able to make some comments about the particular care home that she was in.
Yes.
And some comments, obviously, generally.
Yeah.
Can I just understand how you came to be on the board of Highland Health Board, and what your duties and responsibilities were with that organisation?
Yep, that's a great question, actually. I joined the board because they were looking for somebody with no public sector experience, and at my interview, I told them that the health service was basically a breakdown service that fixed people when they became unwell. It didn't stop people becoming unwell, and my background is trucks and transport, particularly breakdown trucks. So that seemed to resonate. I ended up on the board, my first ever board public appointment, and within 2 years I was vice chair, and I also I was chair of the Highland Health and Social Care Committee, which was responsible for 2/3 of nearly the £1 billion budget that NHS Highland have.
How long did that involvement last?
That's another great question. It lasted 4.5 years. I got my reappointment for a second term, but I was put in a position where I had no choice but to leave. If you're familiar with NHS Highland, you'll know they had some issues with bullying and whistleblowers that brought the attention to the board, and I was very supportive of the whistleblowers, yeah, that didn't go down very well with NHS Highland, and I went through the healing process as a result of that experience afterwards.
Okay. Right. Put simply, were you a critic of the health board and the way in which it operated?
I tried to be a constructive critic,
yes.
So a good example is, when you were talking about the care homes, I was able to share my experience from my mum's experience to say what you're saying is happening in care homes and care provision and person-centred care and all these terms that we use is not actually what's happening on the ground. That's not people's experience, and it was not what people were telling me. So I always tried to be constructive and helpful because I wanted the best for people in the Highlands, but they weren't always ready to hear that.
Okay. Now, prior to going into a care home, which we know was in February 2019, your mother lived at home.
Yeah, she lived at home.
And she lived, and that wasn't, was that with you, or was that?
No, she lived on her own. Yep. Initially, so if we take a step back, she had a diagnosis of dementia. Initially, my sister and I were her carers, and then because we couldn't get any care through NHS Highland, we employed carers who looked after Mum and did a fantastic job at home. We had a team of five carers. And then eventually we got to a position where we had to put Mum in a care home, which we didn't want to do. We had no choice but to do that.
And I think you set that out in a little detail in your statement.
Yep.
But your mother had vascular dementia,
yes,
as you tell us, and you tell us about her being diagnosed with that, and the various systems that were in place for her care. And you mentioned particularly a monitoring system, which is perhaps maybe thought slightly irrelevant to what we're dealing with, but is perhaps of interest. You say it was a particularly good monitoring system,
yep,
whereby you would be able to know what was happening with your mother.
So the kind of standard, health board thing is to give you give people a call button, a personal alarm, which if anybody knows anybody with dementia, first they've got to remember to put the flipping thing on, then they've got to remember to press it if something happens. Then it only tells you when something has happened, you know, the person's fallen over. So I sourced a different system, and it had things like monitors on the doors. So it would tell you, it would tell us what Mum was doing in the house, if she was up in the middle of the night, so we could set alarms. So I remember I think I was working in the Azores at the time, and the alarm went off, and Mum had got out of bed because she was confused between daytime and nighttime. And the alarm went off, and I rang her, and I said, no, it's time to go back for bed. And I was able to see that she'd gone back to bed, and she then slept the rest of the night. So it gave us a lot of information, and it enabled us to adapt our care to her changing needs, and you know, try and get ahead of things rather than waiting for her to fall over and then do something about it.
It's paragraph 13 of your statement. You do say, which I think is probably something that those of us who've had experience like you are aware of, that dementia is very unpredictable.
Yep.
And interestingly, I think you say that perhaps the toughest time for your mother was when she had an awareness that she had dementia.
Yes.
And that thereafter, when her awareness lessened, then it became harder for you, but perhaps perversely easier for her.
Yes, I think initially she had a very unhelpful diagnosis with the GP, who helpfully told her, well, Mrs. Newdick, the sort of dementia you've got is the one that you die from, so that was lovely. And then she had a period of depression because her mother had dementia, so she kind of had an expectation of what was going to happen. And then as things progressed, you know, she became less aware, but then it was harder for us. But yeah, there was but in amongst all that, there was a lot of laughs and some amazing memories too.
We'll come to one of them in a moment.
Okay.
But just so that I think it's important that the inquiry does not really simply regard somebody as a statistical death, but gets a little concept of what that person was like. So prior to her dementia, what was your mum like? If I can call her your mum.
Yeah.
And what was your relationship with her?
My mum's amazing. She was a Londoner, born right in the middle of London, and Clapham Common is where she lived. Moved up to the countryside. She was a great mum. We were really close. Actually, we were really close through dementia. And yeah, she laughed and laughed and laughed, which is why I am determined to carry on laughing as her legacy. And she loved purple, hence the purple. So thanks for your contribution too.
Yeah, well, my tie was not a deliberate endeavour today, but I'm glad it is. Right, obviously, we've heard in this inquiry a lot of very sad stories of people talking about their relatives with dementia. You have one entertaining story which you say is in paragraph 12 of your statement, and you tell us that it is one of your favourite memories of your mother.
Yes.
Can you just tell us about it, please?
Yes, we were out. So one of the things that happened with Mum's dementia, and you might have experienced it too, is the filter for what's acceptable to say in public came right off. And we were out having a meal somewhere, and there was some kids that were being kids and making noise. And really loudly, my mum turned around and said, "Oh, I'm so glad I never had children," with me and her sister, and my sister there too. And we fell about laughing, and we still laugh about that today.
Yeah, well, thank you. Now, Your mother went into residential care in Kintyre House Care Home in Invergordon.
Yes.
And at paragraph 16 of your statement, you tell us that you and your sister, and I think your sister had also some of the responsibilities for caring for your mother.
Yep.
Prior to her going into a care home, provided the home with her likes and dislikes. And you also tell us that there was an 8-page care plan for her. And you tell us about your input into that.
Yep.
You also tell us that there was no DNA CPR notice at that time, although one was later put in place.
Yep.
And was that something that you discussed with any clinicians, or
Yes.
did you just put it in place?
No, I discussed that with we discussed that with the GP and then the care home. So that came a bit later. But we were lucky because we had such fantastic carers. We had a huge wealth of information about Mum's care and every aspect of what she liked and how dementia had impacted her and the sort of the little nuances for her as well. So they had an awful lot of information when she moved in.
Now, in that context, you also had a power of attorney regarding her welfare.
Yes.
And I think your sister had a power of attorney in relation to her finances.
Yes.
Paragraph 50 of your statement, again, it's not necessary to go to it at this point. You do mention that a care plan that you had for your mother, which I suppose in a way led to your removing your mother from the care home. Is that the same care plan that was in place at the start?
No.
Or was it a subsequent iteration of it?
No, it was a kind of like an addition.
Right.
That I did later on. I did after there was a big outbreak of COVID in, I think the name of the home was Burlington House in Glasgow. So the day after I read about that, I did a kind of a revised, updated plan to say here's what would happen.
Right. So effectively a codicil to your care home plan.
Yeah.
The care plan.
Yeah.
Yeah. Okay. Now, you had certain concerns about the care home's capacity to understand the individual needs of dementia sufferers.
Yes.
Could you just explain why you had those concerns?
Well, we had concerns from day one. So initially, we had visited another care home, which we thought Mum would be better suited to. It was a nursing care home, and they had assessed Mum as being suitable for nursing care, and there's a difference with the amount of care that you receive. But NHS Highland said, no, we think it's just residential care, which means basically that the person doesn't have any medical needs. They just need help with sort of daily tasks. So we agreed to put Mum in because there was only really this home available. We agreed to put her in on an interim placement with a view to seeing how they managed. And it was clear really early on that they really didn't understand what was going, what dementia meant to her. So to give you an example, she laughed a lot. Mum laughed all the time. And sometimes that laugh meant I'm really happy. Sometimes it meant I have not got a clue what is going on or what anybody is talking about, but I'm just going to laugh. And they just couldn't tell the difference and just said, well, she's obviously happy with everything because she's laughing all the time. But that's absolutely not what that meant at all.
And was that the purpose of the information that you may have given to the care home at the outset? Yes.
We had, by the time she went into the care home, we'd had a fantastic team of carers that we had recruited. So to put that in context, we couldn't get the care that Mum needed at home because NHS Highland didn't have the care at home provision. So we had no option but to use a funding scheme called self-directed support where you arrange the care yourself. So we employed 5 carers. I did all that stuff. I did all the interviews. I did all the payroll, holidays, rotas, pension plans, policies. I did the whole lot. So there's a lot of work. But the care was amazing. They were amazing. So we knew a lot about Mum, and we had all their experiences to contribute. But the care home it just didn't seem to be able to adapt. They couldn't personalise the care.
Right. You do mention that your mother had been very active during her life. What were the level of activities that she was given in the care home? There was one where they had, they had a TV room with the chairs sitting around, and they would have a bucket in the middle of the floor, and they would get people to throw the ball in the bucket. That was one. Needless to say, she hated that. They had lots of sort of children's toys, which we just felt were really, really inappropriate things, and a great big TV that they got plonked in front of, so very limited activities. You were able to take your mum out, you and your sister were able to take your mum out occasionally. Yeah, we did, and
when Mum moved into the care home initially, I used to still bring her home, and she used to stay with me for the weekend, even though she was a resident in the care home.
Mm-hmm. Okay. Right. Now, we can read what you say about the care home and the onset of the pandemic. One of the things that you were apparently told was that, and this by the care home, that there had been guidance from Scottish Government that visits should be restricted by 75%. Mm-hmm. And while having been told that, as I understand it from paragraph 20 of your statement, the way in which the care home followed that guidance was that there were, in fact, to be no visits. Is that right?
That's right. We went to visit Mum in the care home, my sister and I, and we went to the door and it was locked, and we thought that was a bit odd. And there was a notice on the door that said, we're stopping visits, there's no visits. And that's the first we knew of it. We didn't have any advance notice, warning, anything. Just one day we could get in and see Mum, and the next day we couldn't.
No. And I think you were also told that there might be an availability of an iPad for families to communicate with their loved ones in the home. Yeah. But one of the problems was that there wasn't Wi-Fi throughout the home.
No, there never was right through the whole of the pandemic. There was no Wi-Fi through the home. And one of the issues we had with Mum's dementia, we couldn't speak to her on the phone because she couldn't connect the voice on the phone to who she was speaking to. So she didn't know it was us. So we had no way of contacting Mum at all.
You found out about another care home that was allowing what were termed window visits. Now, one of the things we've heard a lot about in the inquiry so far, and you're well aware of this, is window visits. So we're well aware of the difficulties of window visits, of the progression from window visits to garden visits, the similar difficulties that we've heard a lot of evidence about associated with those visits, and we read what you say about them, and we're well aware of that. But the way in which you were able to visit your mother went back, as I understand it, to no visits, again in September 2020, because there'd been an outbreak, not of COVID, but an outbreak of colds within the home. And
Yeah.
what was your reaction to that?
Well, that was actually the second time they'd stopped visits. We had, not long after she moved in, they shut the home down for 3 weeks because of an outbreak of norovirus. And stopped all visiting then. And then, of course, we got into pandemic times and they had an outbreak of colds and they stopped all visits, including window visits, which didn't make any sense to me at all. So I asked for a copy of the risk assessment that detailed what the risk was of getting a cold through a window that was completely closed. And needless to say, I didn't get that.
Okay. Now, can I take you on to paragraph 38 of your statement? And this is a visit, a window visit that you had on the 4th of November 2020.
Yeah.
And you noticed that there was a wheelchair in your mother's room and a falls mat on the floor, presumably beside her bed. And what was your reaction to seeing those?
It was such a shock. We were like, well, what's happened here? We hadn't had any conversation or correspondence about. So the first thing when you see a falls mat by a bed is you think, well, obviously something's happened and there's been a change. We didn't know anything like that. We saw the wheelchair and assumed the two were maybe linked together, and we're like, well, what the hell is going on? Because we didn't know.
Mm-hmm. And how was your mother at or around that time?
That was
so far as you were able to see her and find out about her.
She was different. So it was that I remember that visit. It was really, really difficult, and it was the first time that we really felt there was a very big change in Mum, and she seemed. It is difficult to find the right word to describe it. There was just something clearly wrong. You know, she always had known we were there. She was disconnected. It was really distressing for us because we could clearly see there was something wrong, but we didn't know what it was.
And did she manifest distress?
Well, it's difficult. For us, yes, that's what it felt like. I mean, it's your perspective about distress, isn't it? So for her to be so unresponsive and uncommunicative, that for us was a sign of distress in our mum. Yeah.
Okay. Subsequently, you raised the question of the criteria for essential visitor status.
Yes.
Can you tell us how you became aware of that? And in particular, was it through the care home that you became aware of that?
It's definitely not through the care home. After that visit, you know, we'd obviously got in touch with the care home and said, you know, what is going on? And it turned out they'd put the falls mat in to monitor Mum at night time in case she got out of bed. And the wheelchair was just stored there in her room, which, bearing in her mind, her room was 8 foot by 6 foot. That's the whole size of her bedroom. You know, they just parked it there because her room was next to their office. So it was just easy. And I asked for a visit because I said, you know, there's clearly something wrong with Mum. We feel that it's the lack of connection with family. Bearing in mind, in 9 months, we'd had 10 and a half hours of actual visits through the window. And they said, well, no. And then they said, well, we called a nurse out. She checked your Mum, and she says she's fine. And funnily enough, I didn't accept that either. So I got onto the health protection team, and the home had said, we don't believe that you would qualify for essential visitor status. Mm-hmm. And I went back to the health protection team, and they said, no, you actually, you would. Mm-hmm. And I said, well, could you tell the care home that, please? Because they won't accept it. So there was I just got caught in this real back and forward between the two, the care home saying I wouldn't qualify, the health protection team saying I absolutely would qualify, and we just were stuck there.
Did some progress happen around about Christmas of 2020? Because I think you tell us at paragraphs 45 and following of your statement that there had been a suspected cases of COVID amongst staff, mm-hmm. and the care home had closed down completely. Mm-hmm. All visiting had stopped. And you say then that you wanted to bring Mum home, but they wouldn't allow it.
Yeah.
Now, this is I think, perhaps the first occasion in which you've directly mentioned bringing your mother home, although obviously it was in the care plan that you had adjusted. Mm-hmm. What was it that triggered you wanting to bring your mother home?
Well, there was a couple of things. So the first thing that happened was we had a notification that a member of staff had been identified. If you can remember back to when we actually had contact tracing, there was a member of staff that had been identified as the contact of somebody who had tested positive. And we had a note about that came from the care home. So I immediately got in touch with the care home and said, well, are you going to test them? And they said, well, no, it's not the protocol to test somebody when they're just a contact of somebody identified through contact tracing. And I said, well, that's ridiculous, because surely the job that she does and the risk means you would want to test. And they said, no, the person just self-isolates. And then after that, we then got the message that actually, a member of staff had tested positive. And that's when I said, right, I want to bring Mum home. And initially, they did say no. But funnily enough, I didn't take no for an answer.
You had a visit with your mum on the 28th of December.
Yeah.
Which you tell us about in paragraph 46.
Yeah.
You say it was very odd.
Yeah.
I think it was, I don't want to disclose your birthday, but you had a specific birthday around about that time.
Yeah, it was my 50th birthday. Okay. I'm happy to sign up to that, yeah.
Okay. And you say it was very strange.
Yeah.
What was strange about that visit?
Well, Mum wasn't in her room. They'd brought her to the door of the day room, which was closed. It was a double glazed door, and the day room was being used by other people. So there was other people sort of in the room, and thank goodness I've got an O-level in drama, because I was kind of miming to my mum outside the window, how are you? And it's the birthday, and I'd put on the jumper that, we'd bought all matching jumpers and things. So there I was trying to, communicate with Mum, and she couldn't hear what I was saying, and she'd got obviously people in the room behind her, and it was just very strange to try and communicate with your mum like that.
Thinking about bringing your mum home at that time, we'll look at it in a little more detail in a moment. But what were you envisaging would be the practical consequences of bringing your mum home?
Well, the reason that I'd done the additional care plan was really because I felt that bringing mum home and being in a household of one person was going to be much safer than being in a care home. So surely the risk of COVID was going to be then much lower. So that's really why I wrote it in the first place. So the care plan said that if there had been COVID found in the care home and mum tested negative, then I was going to bring her home and she was going to stay with me, and then we would sort it out. And practicalities, she'd stayed with me before, so it was no different.
And so far as caring for your mother, was that going to be down to you, or were you going to envisage having additional care support?
Well, we were in some level of restrictions, so this happened over the Christmas 2020 going into 2021. So if I remember right, this was the Christmas that we almost had, yes, and then got cancelled at the last minute. So we were in restrictions about household mixing. Initially, because mum had been in a care home that had been at that stage affected by COVID, we were both having to self-isolate as a result of that.
Now, paragraph 49, you tell us about receiving information or acquiring information from the care home on the 8th of January 2021, when there was a confirmation that 12 residents had tested positive for COVID. Your mother wasn't one of those.
No.
She had tested negative in the initial round of testing.
Yeah.
And thereafter, the following day, you brought your mother home.
Yeah,
on the 9th of January.
Yeah, actually I wanted to take her home on the 8th of January, but they refused to let me pick her up until I had a negative COVID test. So I had to go to Inverness, and of course it took 24 hours to get the test. So that actually delayed me taking mum out of the care home by one day.
So as at that date,
yeah,
the testing for both you and your mother was negative?
Yes.
Right. Okay. What PPE did you have for facilitating her removal back into your own home?
Well, thanks to the joys of Amazon, I was able to order everything I needed. So I ordered everything on the 8th because I knew Mum was going to come home. But because we lived in the Highlands, it was not going to come until the 10th, the Monday. So I went to pick Mum up on the 9th. Having had my negative test, which the care home then didn't want to see the results. And I said to them, you know, I've got no PPE at home. It's all coming tomorrow. Could you give me enough just for today? And they said, no, we need it for our staff.
Okay. Subsequently, there was further testing, and this took place, I think, on the 14th of January. And the results which you got on the 16th, on the Saturday, you say, by this time both you and your mother tested positive.
Yeah. So the health protection team who were managing the outbreak in the care home, they treated us in the same way, and they did follow-up surveillance, COVID testing. We just had the testing out in the community. So I think that was by then the second or the third test that we'd had.
All right. Maybe inferential, but where do you think you contracted COVID?
Well, we worked both infections back because you could track back from the positive test, and of course Mum had a negative test and I'd had a negative test. So Mum had got COVID on the 8th, on the day that I wanted her to take her out of the care home, and I got COVID on the 9th, which was the day I picked her up.
In the immediate days after your mother came home with you, what was her condition?
Well, it was not great initially. So just to set the scene, because I think my mum did amazing. When I went to pick her up, we hadn't actually been able to have any physical contact for a year really, and the care home opened the door, pushed her out the door, shut the door behind her, and she came, and I managed to get her in the car and took her home and showered her and cleaned her, cut her hair because her fringe was a mess, and put moisturiser on her legs and all this stuff. And the care home had told us that she had to be fed, she couldn't feed herself. Well, we sat down to dinner that night. I've got a video of it. And she's chomping away on her pasta and she's drinking herself. Amazing to go from the care home to that situation. And to me, that just showed the power of the connection to family.
You say, perhaps reflecting what you just said, in paragraph 55, that your mum was brilliant in that last week. Hardly had any symptoms. There was just a drop in her oxygen level.
Yeah.
And then, I suppose, a pivot. She decided on Sunday that she was going to go to bed. Subsequently, she stopped eating.
Yes.
And she didn't want anything to drink, although she remained quite lucid, you say.
She did, but just something important just to say about that drop in the oxygen levels. So I knew that the drop in oxygen was a sign of COVID, so poor mum, I was testing her oxygen like every hour or something, and there was a drop in her oxygen, and I thought, so I rang the GP, and the first thing they said was, you've read the reading wrong. I said, no, I haven't. I've done it a few times, and it's the same. And I got in touch with the care home, and I said, could you tell me if any of the carers that were looking after mum went on to develop COVID? Because there's something wrong with mum, and we're trying to work out what it is. And they said, well, we can't tell you that because of GDPR. And I said, no, I'm not asking for the name of the person. I'm not asking for the person to be identified. I'm just asking, were any of mum's carers then went on to test positive for COVID? And they said, no, we're not going to tell you. So the district nurse came out, and because of what the care home said, she said, well, perhaps she's just got a bit of an infection, and they gave her antibiotics. And then the next day we went and I got mum her COVID vaccine, and then it was that afternoon where she tested positive. So, sorry, there's just a bit of context to that.
Not at all. No, you tell us that your mum, I think, had the vaccine, I think it was was it the 14th?
Yeah.
You took her to, presumably, the local health centre?
Yeah.
And obviously, at that time, when you took her to the health centre, she was likely to have been positive.
Yeah, I have to say, I felt like I felt awful after that when I found out that she had been positive, because it was when you had to sit in the doctor's surgery for 15 minutes. And I felt like I could potentially have killed off, half these very vulnerable people. I felt awful. But the health protection team said that the risk was minimal, and there had been no issue. So she had antibiotics, a COVID vaccine, and a positive COVID test all in pretty much one day.
Yeah. And did you get a test? Did you get a vaccine at the same time?
No, I didn't get one until later.
Okay. Obviously, things were now, regrettably, progressing towards the end.
Yeah.
And you tell us that initially in that week, the week that your mother died, you had a particularly, I suppose, quite emotional time with her. Can you just tell us a little bit about what you did?
Well, initially, Mum was she was lucid and unconscious, so we recorded some videos. We did some FaceTime calls with my sister, who obviously couldn't visit family. We recorded messages for her carers just to say, what a good job they did. And we did all the things that you would hope to be able to do with somebody, in those stages. We read poetry. She had my dog spent a lot of the time up on the bed with her. We watched TV and we laughed a lot of things. She loved Victoria Wood, so we watched quite a lot of Victoria Wood and laughed a lot during that time initially. But then by the middle of the week, things had started to change.
Yeah. And I think you say that by Tuesday she was drifting in and out of consciousness.
Yeah, she was in and out of consciousness, and she was. I'm sorry if it's upsetting for anybody, but she was at that stage where she was clearly having conversations with people. She could see people, and that was reassuring for her. Yeah.
Okay. Yes. I think you draw a parallel on a number of occasions in your statement, in paragraph 58 and at another occasion, where the amount of care that was offered to somebody, a lady who was in the same village as you and your mother.
Yeah.
But that lady was dying of cancer. And the level of care that she was receiving juxtaposed to the level of care that your mother was receiving.
Yeah.
Was that something that at the time and continues to, put it this way, grate with you?
Well, I'm not a palliative care nurse or anything like that, so one of the things I was worried about was that Mum was suffering. So we didn't have any palliative care. We didn't have any visits by anybody. We managed to get some Oromorph, which is oral morphine, because the mouth becomes really painful. But I spent a lot of time on Google, what are the stages of dying? Is it normal for people to make this noise, to be doing this? So we didn't have it. It was just me and Mum. And that was really difficult. I think I described that as the loneliest week of my life.
Yes, that's at paragraph 57 you say that, yes. Yes. Now, I'm not quite sure of the exact day that your mother passed away, but you tell us at paragraph 63 that you'd telephoned the doctor, or your GP, I presume.
Yep.
But your mother had already died.
Well, actually, the GP had rung me. So the health protection team were amazing at keeping in touch. I'd just like to pay tribute to them. And there was a particular lady there who was messaging me, and I got to the stage where I just didn't want. I thought, well, what can you say? She's more dying than she was yesterday. I don't know what you say. And I said, I'm really struggling. And she said, well, I think there's actually some help we might be able to get you. And she got in touch with the GP and got the GP to ring me. Okay. But actually, by the time she rang, Mum had already died.
Yeah. And you say it was a peaceful death.
It was so peaceful, which was a real contrast, because the reason that the last 2 days were really distressing, Mum was making really horrible noises, which are, they're kind of normal when fluid builds up in the throat. But gosh, they sound grim. And I was really worried. She was suffering. In fact, I got to the point where I couldn't cope. I couldn't be in the room with Mum. And I went downstairs and watched, of all things, a Greg Davis stand-up show. And he did a sketch about his dad dying. and how they, instead of crying, they ended up laughing around his dad, and how much better that was for him. And that was like a light bulb moment for me. I kind of went, right, that's what I need to do differently. And I went upstairs and I watched the end of the stand-up. So thank you, Greg Davis. And Mum seemed to, her breathing changed just in that last hour and a half. And I was able to hold her hand, and I was able to say, we'd said all the things that, you know, you would hope to say, and it was the most peaceful, with a smile on her face, and she looked as beautiful in death as she did in life.
And you were able to then change her, and you laid her out yourself.
Yeah.
And I think you say that was then the first night's sleep you'd had in a week.
Yeah, because I always wear a light sleep fitness tracker thing, and that week the longest sleep I'd had was 4 hours. So I was exhausted, but I wanted Mum to look nice, and I put her, you know, nice purple stuff on. So I did that. That, I have to say, is one of the hardest things I've ever done. But I did it, and I laid my mum out ready for the doctors and the funeral directors that I knew would be coming.
And the formalities thereafter were gone through. There was a certification of your mother's death,
Yeah.
Where COVID was listed as the cause of death.
Yes.
And then subsequently there was a small and simple cremation, which apparently was what your mother wanted.
Yeah.
And it was just you, your sister, and your nephew
Yeah.
at the funeral.
Yeah.
I think the collection of your mother's belongings from the care home was a bit brutal.
It was a bit brutal, that's a good way to put it. So the care home is actually within a few days. Bearing in mind the care home, we hadn't heard anything from them since I'd taken Mum out of the care home. So our last parting words from the care home to me were they were going to report me to social services for endangering my mum, which they decided not to do. And then we didn't hear anything from them at all. And then they got in touch in a couple of days to say, you need to sort your mum's stuff out because we need the room. So we went to the home expecting that we would go into Mum's room and pack her stuff up. And we found boxes on the step and bin bags. And they basically just shoved everything out on the step. Some things were broken. And the really annoying bit for us was they'd actually included stuff that wasn't Mum's. So we had to then take stuff back to the bloody care home that wasn't Mum's.
Okay. You mention in the section of your statement headed impact, paragraph 71 and following.
Yeah.
You say the main problem was the level of care. I think that's really what you've been talking about, the care that was afforded in the care home.
Yeah. Yeah, there's a big, so to give you the context for that, Mum had, at home, she had between 5 and 7 hours a day of one-to-one care. She didn't have anybody overnight, but we had the monitors. And then when she went into the care home, residential care is basic care. It's just, you know, help with washing and things like that. She had less than an hour of care a day. So it was a big change.
And I think I don't want to cause embarrassment, particularly to your mother's memory, but she was incontinent.
Yeah.
And one of the, I think, problems, obviously, is keeping somebody who is incontinent clean and dry.
Yeah.
And I think you've mentioned on a number of occasions in your statement that was something that you didn't see being done.
No. In fact, we got so fed up with having to, every time we went to visit Mum in the care home, she was clearly soaked through So we got so fed up with every time we went, the first thing we would have to do was change her, that we used to ring the care home and say we were coming in so that at least they would do it. It was a huge issue. It was part of the complaint that we made to the care home, and in the records of that complaint, they didn't have any records for any baths or showers for 2 months.
Right. Now, you made a complaint to the care inspectorate about her care.
Yep.
You tell us at paragraph 73 that all aspects of the complaint were upheld.
Yep.
By the care inspectorate. I don't want to go into that in any detail, but
No.
were any of those in relation to your treatment, the treatment of your mother during the COVID pandemic?
Yes.
Yeah. And what were those specific areas of complaint?
We had complained about the lack of activity, about the lack of contact with family, and just the whole communication or lack of with the care home as well.
And I think in paragraph 74, you tell us about your involvement with the Highland Health Board.
Yep.
And you say that certain things were being said about care homes and how frustrating you found what was being said.
Yeah.
Were you pretty much the sole voice of opposition to what was being said?
Well, I wouldn't say I was opposition. What I was really trying to say was, here's our experience, and this is very different from what the policy and what you're saying we're doing is, and that didn't go down very well. I have to say, when I was on the board, I often went and spoke to staff to get the real story of what was happening, and that was not very popular either.
Yeah. You also contacted the Procurator Fiscal, who at the time, I think the Fiscal had been instructed to investigate each COVID-19 death in a care home. Did you get any response, and have you had any further response or dealings with the Procurator Fiscal?
I didn't initially, and initially I did a Freedom of Information request because I wanted to understand the context of their investigation and whether they were going to take into account the situation. So the reason that I was querying that was Inverness has got a population of 75,000 people. They had 53 people die in care homes. Invergordon has got a population of 3,800 people, and they had 43 people die in care homes. That's 1.15% of their population. So to me, there was something, there's something to understand there. And actually now we have been in correspondence, and I've made that point to them.
Okay. Right. Right. Just in relation to the lessons to be learned, can I focus on what you say at paragraph 78 and 79? Because you make the point, and again, it's something the inquiry has already heard about, but obviously we're interested to hear it from your perspective. And you emphasize the fundamental right to a family life. Can you just explain what you're saying there?
Well, it's a fundamental right to a family life, but all of a sudden, even those of us that had, thought we'd done everything properly and had power of attorneys and all the things that you would need, we had no rights, and Mum lost her right to a family life for rules that were brought in, and I don't think that aspect of quality of life was necessarily considered very carefully when those lockdown measures were brought in. What's an important consideration about length of life is the quality of life. That's the judgment that, for example, NICE use when they make a calculation about whether drugs should be used as a treatment for a particular condition. They look at not just the cost, but they look at the quality of life that it's going to be able to give the person. And I don't think we considered that.
So I think what the point you're making, I think, is balancing what you term the lockdown as draconian, but balancing that against the effect that had for persons who were the subject of that draconian lockdown. Is that right?
Yeah, and also, simply the fact that for most of COVID, the pandemic, the Highlands was in the lowest 2 tiers of restrictions. Yet we had the same lockdown of care homes. It seemed very disproportionate.
You also talk about, in paragraph 82, about lessons to be learned as really about being prepared. And you give the example of, in connection with the work you do, of organising a visit, I think quite recently, to the time that you gave this statement, where persons who were coming across from the States and coming to Shetland found themselves infected in Edinburgh and having to abandon that. So you use that as an example. But can we perhaps just look at what you see as the necessity or the necessary elements of being prepared?
Well, one of my passions has always been public health and prevention. So public health in general gets 1%, if you're lucky, of health spending, and health spending is about half the budget here in Scotland. So that's got to include all your vaccinations, all your stop smoking messages, and all that stuff. That's less than 1% of all our health spending. So, if we want to be serious about being prepared for another pandemic, we need to be serious about putting money and resources into it. And I was lucky to work on the national COVID study when there was no tourism work because the whole country was shut down. I worked on that. So I used to go all around the Highlands collecting people's blood samples and studying long COVID and getting so much valuable data about, what was spreading where and long COVID impacts. And we stopped all that, and we lost all that data and information. So how can we be prepared for another pandemic when we don't have any basic awareness of case numbers, what's happening where, and we've lost all that valuable data, and we still give public health funding so little funding?
Okay. Just one final point in your section on the hopes for the inquiry. You express in paragraph 83 that you hope that the inquiry pulls together some of the lessons learned for the government for the future. And you go back to a letter that the then Health Secretary, Jean Freeman, had sent out to health boards in March 2020. Yep. So that would have been a letter that you would have been aware of, given your involvement with the health board.
I'm trying to remember the date that I left. I'm not sure about that, okay. But it was definitely written to health boards, and I've got a copy of it. Yeah. Yes.
And which said that the Scottish government was well prepared for such a pandemic.
Yeah.
And that they had everything organised.
Yeah.
And you respond by saying that wasn't the case.
No, and I think we've seen from all sorts of evidence that wasn't the case.
Melanie, I think that's all I want to ask you in relation to your statement. As is our tradition, we offer a witness an opportunity if there is anything further that you would like to tell us.
Yeah, there is just a couple of things that I wanted to say, if it's okay. Well, it follows on from your last point, really. Often we have heard that COVID-19 was unprecedented and that nobody knew what to do, and I don't accept that. When I was on the board of NHS Highland, we had all sorts of preparedness training and scenarios. Bearing in mind, we're talking about the Highlands, we prepared for nuclear attacks, we prepared for terrorist attacks, we planned for all sorts of scenarios. That's our job. That's part of public health. And SARS in 2003 and MERS in 2012 were both coronavirus outbreaks. So this was not the first coronavirus outbreak. Just picking up on that point about care homes and quality of life, I think we really have to have a discussion about the quality of life for people in the care home environment. We talk a lot about, person-centred care, but we experienced finance-centred care at NHS Highland, which was very, very different. And, finally, I just wanted to say thank you to giving us the opportunity to share our stories and to listen to families. We have not had and we have not needed any coaching before appearing before you. We've just shared our experiences, and I appreciate that opportunity. Thank you.
Well, thank you very much, Melanie. That's all I have to ask you.
Thanks.
My Lord, that concludes Ms. Newdick's evidence, as I'm not addressing her. I'll call her Ms. Newdick. Could we have 15 minutes to get the next witness in place?
Of course, I'd like to thank Ms. Newdick for her evidence and also for her attendance here today. You're free to leave now, Ms. Newdick, or you may sit in the hall if you want to hear any other evidence, but we'll take 15 minutes, which will take us to just before 11:15.
Thank you, my Lord.
Mr. Gill, thank you.
Thank you.
Sure. Now, good morning again, Mr. Gale.
The next witness is Sharon Boswell, and her witness statement is SCIWT 0327 and then 501.
Very good, thank you, and good morning, Ms. Boswell.
Good morning.
Right, when you're ready, Mr. Gale.
Thank you, my lord. Mrs. Boswell, your full name is Sharon Boswell.
Correct.
And your details, your date of birth and your address and contact details are known to the inquiry.
Yes.
Thank you. You've provided us with a statement for the purposes of your evidence, and I think you are agreeable that the statement and the evidence that you'll give today will constitute the evidence that you would wish the inquiry to have from you.
Yes.
And you're also agreeable that the evidence should be recorded and published.
Yes.
Thank you. You're here to tell us about your late husband, George Ian Boswell.
Correct, yes.
And we know from your statement that your husband was 52 when he sadly died on the 9th of February 2021.
Correct.
And he died in Aberdeen Royal Infirmary.
Yes.
And paragraph 21 of your statement, it's not necessary to go to that, but the death certificate records his cause of death as COVID, diabetes, and multi-organ failure.
Correct.
Now, what you tell us about your husband makes it clear, I think, that he was to you a very special man.
Absolutely, yeah.
You'd known him from when you were teenagers.
Yeah, I actually met him when I was 11, so yeah.
Before teenage then?
Mm-hmm. Yeah. We started going out when I was 15, so
right.
He was 16.
Yeah. And you would have been together for 38 years.
Yeah, at that point, yeah.
At that point.
Mm-hmm.
You have a family, a son
Yes.
and a daughter.
Correct.
Now, again, we always like to obtain a little bit of information about the people who have died rather than just looking at them as a statistic.
Yeah.
So can you tell us a little bit more about your husband? What sort of man he was, what he meant to you, and what you meant to him?
He was the love of my life, and I was to him. He was my soulmate, and I was his soulmate. Very family orientated, very hardworking, lots of friends. Everybody found him such a warm, caring person. Didn't judge anyone at any point. Very approachable. In fact, he was generous to a fault, I would say. Some people took advantage, as people do. He was he was everything to myself and my children. Yeah, it's left such a huge hole in our family. Yes. Yeah.
One of his interests, I think, was that he was particularly interested in coaching football.
He did, yeah. He did that particularly because he went through my son's football career with him from primary school. He started coaching primary school football and then took him right through to juvenile football. So many of the kids there, I had so many messages from when he passed from the children, just saying what a brilliant man he was, the impact that he had on some of their lives, because some of these children came from not so good backgrounds and maybe didn't have father figures, or and they looked upon him as someone that could give them maybe advice if they were requiring it, or he was just that kind of approachable person.
Yeah. Obviously, it's almost impossible to encapsulate what you feel in those, but I think we get the flavour of it.
Yeah, for sure.
Mrs. Boswell, and from your statement as well.
Yeah.
So we are conscious of that.
Mm-hmm.
One aspect of your husband's medical history is something that you mention a number of times in your statement.
Yeah.
And that is that he was a type 2 diabetic.
Yes, he was.
Had that been something of long standing?
A few years, yes.
Yeah.
Yeah, 4 years, I think.
And you tell us that that was controlled by medication, I assume the usual metformin, glycoside, etc.
Yes.
Yeah.
Yeah.
And
diet.
And diet.
Yes.
Yeah. He wasn't insulin dependent.
No. No.
Yeah. And as you put it in paragraph 7 of your statement, it was just something that was there.
Yeah. It was just an everyday thing that we didn't have anything, we didn't have any symptoms, or he went for his usual checks. Everything always seemed to check out most of the time. It just didn't impact his life at all.
Mm-hmm. And you also tell us that, almost coincidental with the start of the pandemic, you received certain medical diagnosis.
I did, yes.
You tell us about that at paragraph 8.
Mm-hmm.
I don't know if you want to say it publicly in terms of the evidence you're giving today, but we can read about it there if you don't want to.
Yeah, no, I've got no problems with it at all.
Okay, well, could you just tell us what it was?
Yep, so I was in bed one morning and George had just happened to discover that I had a lump in my breast. It was just after first lockdown, and it was diagnosed as breast cancer, stage 2, 3.
I suppose that fairly devastating piece of information.
Absolutely, yeah.
How did that make you approach the circumstances of the onset of the pandemic?
Okay, so obviously I had to receive chemotherapy and radiotherapy, which affected my immune system. George was just very, very careful when he was out and about. Obviously, I didn't get out much with being so ill with chemotherapy and what have you. It made him super vigilant as to where he went, what he did, but obviously he had to go to work because he was an essential worker. So he wasn't happy about it. I wasn't happy about it. When he came home, it was always, he stripped off at the front door, straight into the shower before he even came near me. It was...
Yeah. You, I think, were within the shielding category.
I was not put on it officially, but my consultant told me immediately that I was diagnosed, that I should shield, yes.
Yeah. And I think one of the points you make, and make with some force in your statement, is that you feel that your husband should also have been within the shielding category given his diabetic condition.
Yeah, absolutely. Know what I know now, 100%.
Yeah. Okay. Just to, again, get a little context, your husband was a lorry driver for DHL.
Yes.
And I think DHL at that time were contracted to Argos.
That's right, yeah.
So I know that you have certain views as to how your husband contracted COVID.
Yeah.
And that involves contact with one of his colleagues.
Yeah.
Before we go into that, can I just emphasize, please do not mention the name of that colleague. I know you've provided that to the inquiry. Mm-hmm. We are aware of it, but please don't mention his name at this stage. Mm-hmm. What were your husband's working arrangements during lockdowns?
So the first...
during the lockdown?
The first lockdown, obviously everything was super vigilant and whatever. Nothing was put in writing for him as to how to approach things, but they drove a lorry because they were delivery drivers, but the driver's mate had a separate vehicle during lockdowns, so that they didn't have that contact. Obviously, they had to lift things like washing machines, what have you, to people's properties, but it was outdoors, so they were given masks, masks and gloves. They were given hand sanitizer and like a spray to spray the interior of the lorry, what have you, but that was about it. That was in the first lockdown, but then things changed.
You say that your husband, George, wasn't happy about these arrangements.
No, he didn't
Can you explain how he expressed that unhappiness to you? Yeah,
he wasn't happy that he was in contact with other people anyway. And when it came to, there was a second lockdown in Aberdeen because obviously we had an outbreak, I think it was August of 2020. And they did not put that initial, the driver's mate into a separate vehicle. They were working in the same vehicle at that point. There was no perspex, there was no, he didn't feel that the PPE was adequate enough. He just felt very vulnerable, probably because of me. I think it probably emphasised it a bit more to him.
Mm-hmm. Mm-hmm. And you tell us in paragraph 9 of your statement that he felt that he had no choice but to go to work.
No, he had. No. If he was given the choice to stay at home and keep me safe, he would have did that, 100%.
And was that because of the direction that he was receiving from his employer?
Yes. Yeah. They were so bad as employers that. Obviously, I had nothing was face to face as much at hospital and whatever. As far as when I got my first appointment with my oncologist, it was on a screen, obviously. He'd asked his employer if he could stay at home with me that day to get this, to see whether I needed chemotherapy, blah, blah, blah. And they told him no. That was the kind of employer they were. So they didn't have his best interests at heart at all.
And I think you also mentioned that, so far as your husband was concerned, there was no offer of furlough.
No, not at all.
Yeah.
The last question, Mrs. Boswell, just for the avoidance of doubt. In the first lockdown, perhaps I should start by saying your husband normally, that is pre-COVID, worked in a team of 2,
yes,
driving a delivery lorry.
Yes.
And in the first lockdown, there was a change in the normal procedure,
yes,
whereby he would continue to drive the lorry that no doubt contained the vehicles, the material to be delivered, but the mate came along in another vehicle, correct?
Correct, yes.
Yeah. But in the second lockdown, the second vehicle was taken away from the work situation,
yes,
and your husband and his mate required to use the same vehicle.
Correct. Yes.
And I'm envisaging either a van or a lorry.
It's a lorry,
one way or another. It's a what?
A lorry, yeah. So it was just a cab. Yeah.
Yeah, and there's just a cab, just a normal lorry cab.
Yes.
That had 2 or 3 seats and a bench or something like that.
That's right, yeah. Just 2 seats, yeah.
2 seats. Yeah. Very good. So in close proximity.
Yeah, very.
Very good. Thank you. Sorry to interrupt.
No, that's okay. Thank you very much. Was that, just following on the Lord's point, when the change occurred in the second lockdown period, whereby your husband was driving with a mate in the lorry,
yes,
in the lorry cab, and given your vulnerability at the time. Did your husband make any representation, do you know, to his employers about that?
Not that I'm aware of. Not at that point, no. They just thought that they were doing what they were supposed to be doing, so they weren't the most approachable bosses anyway, so I think that was, yeah.
Can I ask a follow-up question as well? I'm sorry, Mr. Gill. But did the employer provide any explanation for what was obviously a change in policy between first and second lockdown?
None whatsoever, no.
Thank you, my lord. Your husband did ask for some time off at Christmas.
Correct.
That year.
Yeah.
And this had been approved, as you tell us.
Yes.
And however, presumably because of the nature of the work and the volume of work being required, particularly at that time, given that deliveries were necessary.
Yeah.
Your husband was asked to come on the Tuesday between Christmas and New Year.
Yeah, not asked, told. He was told.
It was an instruction rather than a request.
He was told, yes.
Okay. And as you tell us, you're almost certain that that's the day that your husband caught COVID.
Yes.
Right. You provide us with some details of how you've come to that view, and can I just remind you not to name the individual concerned, but perhaps can you just explain how you've come to the view, and presumably your husband came to the view, as to how he contracted COVID?
Yeah. Okay, so his mate was, his daughter lived in England for a lot of time with her mum, and it was decided that his daughter was going to come back into Scotland to live with him. And in December, her mum travelled from Kent to Aberdeen on the train and visited with the driver's mate and her daughter. When she went back down to Kent, she had phoned him the day after saying that her dad had tested positive for COVID, and that she was going to be getting tested as well because she had travelled in the car with him to the train station. So the driver's mate immediately went and got him and his daughter tested for COVID the same day, when it was only like 2 days beforehand that they'd had contact. There's no way that they would have showed up as a positive test, in my opinion. So because of that, he went to work on the Tuesday. Yeah, he didn't tell his employers that he'd went for a COVID test either.
Right. Did he tell your husband?
Yes.
Yeah.
Yes. My husband told the employers when he was in his bed ill, when the big boss had phoned to see how he was doing.
Now you tell us how your husband's progressed from an initial test to testing positive.
Yes.
You tell us at paragraph 14 of your statement that within about 10 days, your husband started to feel unwell. Yeah. And he was ill for about 2 days. Yeah. And on the third day, he had really bad cramps.
In his back, yeah.
In his back?
In his back, yeah.
Was that a symptom of COVID that you had come across in the material that had been issued?
Absolutely not. We had no idea what was going on there.
Yeah. He went for a COVID test. In fact, you both went for one on the 14th of January 2021.
Yes.
With the exception of the cramps, did your husband have any other symptoms?
I think he was very lethargic, that is for sure. Appetite, no appetite whatsoever. He was being sick and had diarrhea as well. But apart from that, no cough, not at the start, nothing. No.
And in fact, I think you both tested positive.
We did, yes.
And you tell us that your own symptoms were lethargy and that you lost your taste and smell.
I did, yes. It was very difficult to actually figure out what was, because I was still suffering from chemotherapy. I was going through radiotherapy that week as well, so it was difficult to say what symptoms went with what was going on.
If you feel able to tell us, can you indicate how your husband's condition progressed after that?
Yeah. So he was in bed for a couple of days. We were both in bed the first day. He took me to my last radiotherapy appointment on the Friday, which was a horrendous experience. And that was the last thing that he was able to do for me. He never got out of bed again after that. That was the day that we both tested positive. He just became weaker and weaker. He wouldn't eat. He was vomiting, so his metformin that he was taking was probably coming back up as well. He started getting shivers. Found it very difficult to get up and down stairs. And then by the Tuesday morning, first thing, I heard him get up to the toilet. Again, he was sick in the toilet. And when he came back downstairs, he was coming downstairs and had to stop me 4 times. He was that weak. He went into the living room and I got up and went through and I was like, "Are you okay?" Previous times before this, I'd asked him if he wanted me to phone 111 for advice or whatever, and he'd always said, no, I'm good. When I went into the living room on this occasion, I said, "Do you want me to phone 111? And he said, yes. I took another look at him, and I just phoned 999.
So you elevated it from 111 to 999?
Yes, just by looking at him once I put the light on.
And I think one of the other symptoms he had at that time that you mentioned was that he was having breathing difficulties.
Not that I could see. I mean, he was very hunched over and what have you. It wasn't until the first paramedic came in that...
I see.
Yeah.
And an ambulance crew did come to your home.
Yeah.
Took your husband to Aberdeen Royal Infirmary.
Yeah.
And as you tell us, that was pretty much the last time you saw him.
Absolutely. I wasn't even allowed to say goodbye to him. I wasn't even allowed to give him a hug or...
Mm-hmm. Yeah. Once he went into ARI, were you able to keep in touch with him?
The first 6 days I was able to video call him, which I did and which our family did and friends quite a bit. But yeah, it was harder and harder as the days went on. I was very, very worried about him.
What advice were you being given about his condition from those in charge of his care?
It was very, very limited. When he first went in, we found it very hard because we were supposed to get updates from the nurse in the morning and the doctor sometime in the afternoon or evening. And due to files, I don't know, systems in the NHS, my home phone number was on the record, and they kept phoning this home phone number, which just rang out, and that rang out because I didn't have a phone at that point. Numerous times we told them I only had a mobile. Numerous times I didn't get that phone call, so the updates were very limited at times, which us as a family found very, very, very difficult. They did sort of, they always prepared me for he might need to go on a ventilator and whatever, and I just never, I knew that they had to say that. I just never thought, I never ever thought that would happen. He's 52 years old. He's got everything to live for. He was relatively healthy, and I just thought, yeah, they're just saying this because they need to say it just in case. And
So you thought that they were probably pre-warning you, but you hoped perhaps that it wouldn't come to that.
Yeah, I think your brain just works in that sort of way, doesn't it? It's protection mode.
Yeah. Obviously, things deteriorated.
Yeah.
And paragraph 19, you describe, as things went on, that it was always just doom and gloom.
Yeah.
Can you explain what you mean by that?
Okay, so yeah, I kept a diary when I had to go start my chemotherapy, because George couldn't be there with me. He asked me to keep a diary on how I felt and, you know, just the symptoms that I was having, etc. So I decided when he went into hospital I would do exactly the same for him. So when he came out, he could read, you know, what we were being told and what we went through as a family.
I think you became aware that he had a bacterial infection in his lungs.
I did, yeah.
And that there was a difficulty in regulating his sugar level.
Yes, so he was starting to get insulin injections by that point. He was still not on the ventilator at that point. Right. Yeah, they couldn't get his blood sugar levels under control at all. Yeah.
And I think also, regrettably, he had also acquired a fungal infection.
Yeah, that was after he went on the ventilator. He had no bacterial infection when he first went in. He developed the bacterial infection, and then once he went onto the ventilator, it was a fungal infection as well. And now reading his medical notes, it was the fungal infection that was the final straw.
I see. You tell us about your husband's passing. Paragraph 21 of your statement that his organs had started to shut down.
Yeah.
And you got a call out of the blue from a doctor at the hospital to say that you needed to get to the hospital with your family. So that presumably was you didn't really need telling what that meant.
No, absolutely not. I mean, by this point, he had deteriorated so much that he'd been put on dialysis for his kidneys. He had had 2 chest and chest drains inserted on his left side. So yeah, I mean, reading back on my diary that I kept at the time, I can see what was happening now. At the time, no, I couldn't see what was happening. I just couldn't accept it, I guess. So yeah, we were taken to the hospital, told to go to the hospital, which I'm very, very grateful that we were there at the end for him. And yeah.
And you were there in time as before he passed away on the 9th of February.
We were, yes, about 20 minutes.
Was he conscious?
No, he was still on the ventilator.
Yeah.
When we did go into the room, he did turn his head.
Yeah. And I think we've already noted that on his death certificate is mentioned COVID, diabetes and multi-organ failure.
Yeah.
Again, you tell us about the circumstances of the funeral. We've heard many witnesses about the restrictions on funerals, so we are very familiar with this, but yours was a limited funeral, 20 people, and the coffin was sealed.
Yes.
You didn't have any initial contact with the Procurator Fiscal.
No.
But did that change, or
Yes.
has that changed?
That has changed now, yeah.
And in what context has it changed?
They are now investigating his death through his work, and not providing testing for him, or so I've had to give a statement to the police.
Yes. And I think, again, without mentioning the individual concerned, I think the driver's mate was subsequently sacked.
He was, yes. He appeared at my door just after the funeral and said that he was going back to work because he was actually off work with COVID as well. He went and got tested the day after George and I did. and he was going back to work, and they met him at the gate and escorted him off the premises because he was being investigated. At that point, he never said why he was being investigated, but I believe that he was being investigated because they thought that he had, well, he'd lied anyway, that he'd said that he didn't go and get a COVID test, but George had told them on the phone before he went to hospital that he did, so.
Dealing with the impact on you, Mrs. Boswell, you've told us about the length of time you and your husband had been together.
Yeah.
You've told us about the closeness and the depth of your relationship.
Yeah.
You say at paragraph 26 you're devastated that he's gone, but you're also furious.
Yeah.
I think we can probably understand the devastation. I don't want to go through, ask you to deal with that anymore, but the fury, can you explain where that emanates from?
Yeah, just so angry at the English government in particular. Yeah, just especially now with the more that you hear about how they just thought we were going to sail through this, even though what was going on with Italy originally, they just the arrogance of it. Oh my God, yeah. Things that should have been put in place before this got as bad as it got. Just the fact that he wasn't shielded when I've got an article that was written in August 2020, 6 months before he died, and it says COVID-19 and diabetes, a deadly combo. You know, it's yeah. I'm so angry.
Now that article is a magazine article.
It is, yes.
That you've shown to us, and we've asked that you provide us with a copy of that. I'm sure we could probably find it online somewhere,
yeah.
but we'll, if we may, take the advantage of you having a copy.
Of course.
And we will return it to you.
Yes.
In due course, because it's obviously a matter of interest to us.
Yes.
Your anger is, I think, in part, and manifests itself in paragraph 31 of your statement, where you talk about finding out the UK government's disregard for the lockdown rules.
Yeah.
Makes all this even harder to bear.
Absolutely.
Is this essentially Partygate?
Yes, absolutely. To know that they were being so disrespectful while my husband was in hospital. My husband was in hospital dying. My best friend was in hospital as well. She was very, very ill as well. And they're disregarding every lockdown rule so they could have a party here and there.
Now, obviously, you lost your husband and had to deal with cancer.
Yes.
You do tell us, I think it's paragraph 34, that you've had assistance from an oncology psychologist.
Yes.
Has that been of any assistance to you to deal with your grief?
Absolutely. I don't think I'd have got through this without her support and everybody else's support that I've had. Yeah. And I just feel so lucky that I was able to access that. Not lucky, oh God, lucky with cancer is not a really good way of putting it, but I was able to access her very quickly because of my cancer, whereas I probably still wouldn't have a psychologist, if I had to go on a waiting list.
Yeah. Just on the point about your husband not being on the shielding list, because this is one of the points, as I understand your statement, that you really want to get across to the inquiry.
Yes, absolutely.
That he should have been.
Yes.
If he had been on the shielding list, what difference would, it may be obvious, but what difference would that have made to your daily life?
I would have had more time with him for sure. I think that, you know, he would have been at home to take care of me as well, because it was so difficult going through chemotherapy when he was at work, and the stress of him. I don't know. I remember one night that after I got my diagnosis, and he knew that he had to go to work after I was getting my chemotherapy, and I heard him crying upstairs because he was scared. He was scared that COVID would kill me. Yeah. Mm-hmm. Little did we think it would be the other way around. We never thought. We were young. We didn't have, you know, health issues as such. You know, no lung problems. Nothing. No signs that this was going to happen.
Mm-hmm. I think one of the other points you make, Mrs. Boswell, is that going back to when your husband started to feel unwell, and perhaps touched on this a little, that his symptoms were not the classic symptoms, the common symptoms that were being talked about. And you mentioned this at paragraph 33.
Yeah.
And what you say is that there was no real clear guidance available at the time.
No. I mean, at time, obviously, I when he was ill, I had Googled on my phone just to see when I should seek help. As I've mentioned, I had said to him twice previous to the day that he got taken into hospital, should I phone 111? Because I was really, really concerned. I ended up with an infection in my hand due to a cat bite while he was in bed. I think that he went into hospital on the Tuesday, so that must have been on the Saturday. And they wanted to take me in because I was still no immune system with chemo. They wanted me to go in for IV antibiotics, and just the terror that I saw on his face that he was going to be left at home by himself. I'll never, ever forget that. You know, he was scared, and at that point I knew that there was something not right. So I said to him, "Do you want me to seek advice?" I believe he knew at that point that he was very, very ill. He just was a very stubborn man and didn't want to cause a fuss. You know, that's just the type of person he was.
Mm-hmm. Right. Some of the lessons to be learned that you've identified, I think you say about the need to give more information to the public than it was. Is that particularly in the context of the information regarding the dangers for persons such as your husband as a diabetic?
Yep.
And also possibly more comprehensive information about symptoms.
Yeah, absolutely. I mean, pre-existing conditions. What is that? You know, even now, I don't know what is pre-existing conditions. Even now, like if I speak to someone that's a stranger and I say, you know, I've lost my husband to COVID and oh, did he have any underlying health conditions? Yeah, he was. Oh, yeah. And this was right at the start of his death. You know, how did they know this and I didn't know this? It's.
Is it? Have you formed, perhaps from other people you've spoken to, that almost your husband, because of a pre-existing condition of diabetes, was more susceptible to COVID?
That's exactly what they're telling me, and it's something that we did not know.
You also mention paragraph 37, the flights, and you're quite trenchant about your views on that.
Absolutely. And I mean, at the end of the day, I know that Scotland didn't have the power, well, our Scottish government didn't have the power to stop that. But why did the UK not stop these flights coming in from these places that already were rife with COVID? I think it was too little, too late. Far too little, too late when they did it.
You are complimentary of the then First Minister and the way in which she addressed the nation in paragraph 38.
Yes.
Can you just give us a little more context to that, please?
Yes, I think that I understood from our Scottish Government a bit more about what was going on. I felt that it was a lot more honest than what the English Government were telling us. I felt more empathy from Nicola Sturgeon and the other people that were talking every day. Just the fact that the Scottish Government also wanted the English Government stop their briefings, and the Scottish Government continued their briefings, beside the fact that, you know, the English Government didn't want them to do that. I just felt that our government were a lot better at putting over information than the English Government were.
And your hopes for the inquiry, particularly that you'll appreciate, and I think we've discussed this, that there are certain things we can't provide you with an answer to.
For sure, yeah.
But one of the things that, and you've made the point, and we have it very clearly from you,
yeah,
about why your husband was not put into a shielding category because of his diabetes.
Mm-hmm. Absolutely, yeah.
Now, Mrs. Boswell, thank you very much for engaging with me in this discussion. Is there anything else you would like to mention to the inquiry before you leave us?
Yes, please. Just as far as the hopes for the inquiry are concerned, there's also another question that I have thought about. Yeah. I was hoping that the inquiry could maybe answer and tell me about immunisations. When they were first rolled out, they were distributed to obviously our NHS, our care home staff and whatever. I'd like to ask, why were essential workers not part of that first lot of people that were immunised, you know? The elderly in nursing homes were immunised from, I think it was the 3rd of December in Scotland. And obviously it leaves me with questions as to if he had had his first immunisation, would have it turned out differently, you know? That's definitely another question.
Well, this inquiry will be looking at the rollout and of the vaccination programme, and it may be in that context we'll be able to assist you somewhat with that.
That would be good.
But subject to that, Mrs. Boswell, thank you very much.
Thank you.
Thank you, my lord.
Yes. Thank you, Mrs. Boswell. I'm very grateful. You may leave. You are, of course, free to stay if you wish to hear any of this afternoon's evidence, but thank you.
Thank you.
Now, Mr. Gale, we're due to take the next witness at 1:30, is that correct?
1:30, yes, my lord.
Sorry, you want to say something?
No, my lord, I was just seeing whether or not there was any possibility of advancing that witness, but I think the other witnesses have been given time, so I'm afraid it's probably not possible to do that. But
very good. We'll reconvene then at 1:30. Thank you very much.
Thank you, my lord.